I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. We're talking today about women's health issues, specifically hormones, and today we're talking about contraceptive options, menstrual cramps, hormone imbalances. Now, this is part 2 of a show. We did part 1, and it became so popular that there was such a demand, I had to come in and do part 2, because you, the listeners, my patients, my staff, were saying, you didn't cover this, you didn't cover this, you didn't cover this. I said, okay, I'll do a whole nother show for you. Now, if you miss any of this show or any shows, we're all on the website, drjoe.com. Just go to search bar, type in the topic you're looking for. It should be there. And we've done, over 1,000 hours of audio and video, so you can watch them, you can listen to them, whatever makes you happy, it's all there. We have a blog on the website as well. And if you have questions, always send them to me through the website, drjoe.com. So let's talk about oral contraceptives now. I want to talk about some common side effects of oral contraceptives, including hormone contraception, which is taken to prevent pregnancy, of course, and there are other medical reasons. Menstrual spotting, if you take it, it can cause menstrual spotting, nausea, breast tenderness, headaches, migraines, weight gain, mood changes, missed periods, decreased libido, vaginal discharge, changes in your eyesight for those using contact lenses. And now let's dive a little deeper into some of these side effects, because I want to let you know what's happening, because many times patients come to us and they'll say, Dr. Joe, to my staff, I've got this condition, and we check the nervous system. Of course, as chiropractors, we always check the nervous system. We check the digestive system. Do you have acid reflux, heartburn? Are you absorbing your nutrients? We look at your diet. We all could use a little tweak in our diet. We look if they're taking supplements. If you're not, I recommend supplements in most cases. But then I start to dig into their history of their medicine, because many times medicines have side effects. So intramenstrual spotting, breakthrough vaginal bleeding is common, and it's between expected periods. Now, this usually resolves in about 3 months after starting the pill. So if you have it, after 3 months, the doctor should tell you it should calm down. Nausea. Some people experience mild nausea when first taking the pill, but the symptoms usually subside after a while. You can take the pill with food or at bedtime. That may help some of the nausea, or if it's severe or persistent longer than 3 months, you need to go back to your medical doctor and say, hey, there's something up here. What else can we do? And again, there's different types of birth control pills, don't forget. Breast tenderness. Birth control pills may cause breast enlargement or tenderness, and it normally resolves after a few weeks from starting the pill. Anyone who finds a lump in their breast or has persistent pain or tenderness or severe breast pain should seek medical advice. Don't be stupid. Okay, get things checked. I have a patient right now. She was in a car accident, and we were adjusting her, and she's getting some relief, but she's still having headaches. And I said, please, B, I want you to get an MRI. I just had an MRI 3 weeks ago, or whatever it was, or 3 weeks before the accident. I said, yeah, but now you've had an accident, and I'm not sure I'm getting through to her. I said, listen, new things happen when you have the accident, but I just had an MRI. So I'm fighting with her, and I said, please, I'm begging you, get the MRI, and she's fighting me. Now, I hope I convinced her. Last time I saw her, I said, you really need this MRI. If it comes back negative, great. I was wrong. I want to be wrong. Whenever I do tests, I want to be wrong. That's my goal as a doctor. But I hope we find nothing. So if you have tenderness, if you have something, go get it checked. There's absolutely nothing wrong with getting things checked. When you're taking birth control pills, headaches and migraines, pills with different types and doses of hormones may trigger different symptoms. Weight gain. Clinical studies have not found a consistent link between the use of birth control pill and weight fluctuations. However, fluid retention may occur, especially around the breasts and hips. This is according to one review. Most studies have found an average weight gain of under 4.4 pounds at 6 or 12 months with progestin-only birth control pills. Now, studies of other birth control methods show the same gain. So you might gain a little bit of weight. It's one of the issues of doing this. Mood changes. Studies suggest that oral contraceptives might affect the user's mood and increase the risk of depression or other emotional changes. Anyone experiencing mood changes during pill use should contact a medical provider. Now, if you have acid reflux or heartburn, burping, gas, bloating, how many people have that? Raise your hands. You're not digesting your food properly. Digestive symptoms are a warning sign. It's like a fire alarm going off, and people just ignore it. Well, I am a little gassy. I am constipated. I have diarrhea. Nobody worries about that. You should. These are warning signs something's wrong. Is it a pinched nerve going to your digestive system? Is the stomach pushed up against the diaphragm? We may have to adjust or pull the stomach away from the diaphragm. Is it a problem with what you're eating? You're eating food you can't digest. Are you getting older? Your digestive enzymes plummet when you get older. So start taking digestive enzymes. We have a great one on the website, drjoe.com, Dr. Joe's Digestive Enzymes. Whenever I eat a cooked meal, I take digestive enzymes. And it's amazing how much easier it is to digest just about any food when you take the digestive enzymes. So if you're having problems, always check with your doctor, but there's other alternatives as well you might want to consider. If you're missing periods, even after proper pill use, a period may sometimes be missed. Factors that influence this, including stress, illness, travel, hormonal, thyroid abnormalities. If a period is missed or is even light when using the pill, a pregnancy test is still recommended. You can get pregnant while on the pill. Remember that. Do that before starting your next pack, because if you're pregnant, you want to stop taking the pill right away. I have a relative who took the pill and she got pregnant, and I have a niece now because of that. So just think, just because you're on a pill, it's the end all be all. It's not. I'm going to give you some options as well as we go through this. It's not unusual for flow to be a little light or missed altogether on occasion. If you're concerned, of course, seek medical advice. Decreased libido. The hormones in a contraceptive pill can affect your sex drive or your libido, and it happens in some people. If decreased libido persists or is bothersome, this is something to talk with your medical provider. In some cases, birth control pill can increase libido. For example, by removing concerns about pregnancy and reducing the painful symptoms of menstrual cramping, it can increase your libido. Once again, still be careful. Endometriosis and uterine fibroids. That can happen when you're on a pill. If I have time, I'm going to go through the endometriosis and uterine fibroids a little more in depth. Vaginal discharge. Change in the vagina will cause discharge, and that can occur when taking the pill. This may be an increase or decrease in vaginal lubrication or a change in the nature of the discharge. So vaginal dryness is an issue. You can add lubrication, of course, and these changes are not usually harmful, but alterations in color or odor can indicate infection. Anyone who's concerned about changes should speak to their medical providers. Again, eye changes, hormone changes caused by birth control pills have been linked to thickening of the cornea of the eye. That's pretty serious. Oral contraceptive has not been associated with higher risk of eye disease, but it may mean that the contact lenses no longer fit properly. So if you're a contact wearer, talk to your ophthalmologist. And if you experience changes in your vision, the lens tolerance, that can happen during the pill. I used to wear contact lenses. They bothered the heck out of my eyes. I do not take the birth control pill, full exposure. But I decided I'm just going to go back to glasses because it wasn't worth it to me. And you couldn't see far, you couldn't see near. I'd much rather be able to see. So, risks that combined with the pill can increase the risk of cardiovascular disease, such as blood clots, deep vein thrombosis, a clot in the lung, stroke or heart attack. Birth control pills also have been associated with increase in blood pressure, benign liver tumors, and some types of cancer. The pill should not be taken by women who are pregnant, smokers over the age of 35, or anyone who stopped smoking within the last year. And if you're over 35, of course, it's worse. Of course, folks, don't smoke. Please, I know it's hard to get over the addiction. When you change your diet, when you get healthy, most people are able to get over all their addictions. Because you got to get the digestive system working so you can absorb your nutrients. You got to get the body getting the nutrients that it needs so it doesn't need external stimulation. Many people that are addicts have a change in the brain chemistry. People that are addicts have low dopamine receptor sites. Dopamine is a neurotransmitter that makes you feel pleasure. And if you don't absorb dopamine properly, it's sometimes genetic, you're more likely to get an external source. And that's many times where addictions come in. So when we get the body healthy, we give the body the raw materials to produce dopamine and norepinephrine and GABA and serotonin, then the body sometimes is able to say, I don't need this external stimulus. So if you have alcohol, any type of gambling, cigarettes, it's a good idea to get healthy. And if you want to come see us, we can put together a protocol to help get you healthy. No guarantees, but in most cases, people are thrilled. Okay. Anyone with obesity, those who are taking certain medications, again, we're talking about reasons you shouldn't take birth control pills. Anyone who had thrombosis, a stroke, or a heart problem. Anyone with a close relative who had a heart clot before the age of 45. Anyone who's had severe migraines, especially if they have the aura, which is a warning sign. You see lights around things. Anyone who's had or had breast cancer or disease of the liver and gallbladder. Anyone who's had diabetes for at least 20 years or diabetes with complications. So there's a lot of reasons not to take the birth control pill. And sometimes doctors are a little more willy-nilly. Oh, just take it. Don't worry about it. Read up on these things, folks. You're taking a hormone into your body to alter how your body works. And not for the better, oftentimes for the worse. So if any of the following occur, the user should stop and see a medical doctor right away. Abdominal or stomach cramping, chest pains, shortness of breath, severe headaches, eye problems, blurred vision, swelling of the ankles and thighs, swelling in the calf. All of these are signs you need to seek medical help immediately. There's alternatives. There's condoms, of course. There's male condoms, and there's the female condom. And it has a ring at each end. Now, for most types of condoms, the risk is of it not working is about 18% over a year. So there is a risk. Nothing is foolproof here. The diaphragm. Now, it's kind of a dome-shaped rim, and it's a cup. It fits over the vagina and blocks the cervix, and you use spermicide, and that prevents the sperm and the egg from getting together. That's how you get pregnant. Disadvantages include possible urinary tract infections and irritation, and that can cause problems. 6 to 12 pregnancies occur for every 100 women that use it. Most of them because of human error. Okay? Here's the thing. I want to teach you something that I was raised with as a Catholic boy way back when, and that's the rhythm method. What happens is you can chart your cycle. And you can chart your cycle and see how many days your cycle is. So let's assume your 28, 29, 30-day cycle. When your cycle is supposed to start, count back 14 days. That's when you're most likely going to be ovulating. That's the time you get pregnant. So what I want you to do is use other forms of birth control if you don't want to get pregnant. And then that day, 14 days back, 3 days forward and 3 days back are your most fertile times. So that's a week. In that time, you can use other forms of birth control, but if you can avoid contact, if I can keep this clean here, that's going to be a very, very good thing. So not the rhythm method by itself, the rhythm method in conjunction with other birth control methods are going to be your best bet. Remember, those 7 days in there, some people a little more lenient, they say 5, I'm going to give you 7. That's probably going to be a very effective way of making sure that we don't make babies if we don't want to. If you do want to make babies, count 14 days back, and that's the best time to make babies. So there are methods available to you. You just have to be smart enough to do it. Okay, and it depends what your goal are. If your goal is not to get pregnant, this is what you need to do. Now, let's move on to long-term side effects of oral contraceptives. Those are the short-term ones we just talked about. Some people take birth control pill for much of their adult lives without a break. Others use long-term hormonal contraceptive devices such as IUDs. IUDs are very effective as well, and they've come a long way. Now, they have them with hormones, without hormones. If I was going to give you advice on that, I would recommend without the hormones. Once again, hormones are rough. And again, chart your cycle. When you're fertile, be more careful. It is what it is. We're grown-ups. We got to play by the rules here when you're an adult. That can stay in place for several years in IUD. The safety of long-term hormonal birth control may depend on a person's risk factors, such as age, medical history. Many people use hormone birth control for contraception, but others take hormonal birth control to manage long-term medical conditions, like we said, heavy periods, endometriosis, menopause symptoms. Doctors approve the use of these pills for these conditions, so they should be okay to take for these conditions. But once again, what are we getting at? We're not getting to the cause of the problem. Why do I have endometriosis? Why do I have polycystic ovarian syndrome? Or why do we have menstrual cramps? Could be the broad ligament attached to the sacrum. I gave a lecture one day to a bunch of doctors. I was teaching some postgraduate work. And every doctor in the room said, I never thought of that before. The broad ligament, the sacrum rotates, pulls on a uterus, and then you're more susceptible to pain. So when you understand how the body works, it makes life a lot easier and try to fix it. And just like making babies, when you understand how the baby making machine works, it's a lot easier to take precautions. Again, it's what your goal is. And you got to be careful, of course, with venereal diseases as well and social diseases. That could be a whole nother lecture in itself. But folks, if you play in the big leagues, you got to be careful with that. My personal opinion, get blood testing. If you have a new partner, get them blood tested. Get yourself blood tested and say, here's mine, where's yours? Okay, here's our tests. Great. Now we can move on from here. But when you get those galloping cooties that'll come with social diseases, many of them are permanent. They're forever. So you got to be careful with that. And once you have it, if you can't get rid of it, then you got real problems. And there's some that are just annoyances. And then there's some of them that can actually be very deadly, of course. So I got to get on my soapbox and say, folks, please be careful out there. In the Atlanta area, 1 in 3 sexually active people have herpes. That's a big number right there, folks. And so you got to be careful, choose wisely and be careful. And then you can make decisions. Is this something I'm willing to risk? Am I willing to take proper protection? Or is it maybe something that it's not worth the risk? And then you make that decision. It's all up to you. But that's why I strongly advise getting your blood work done. I had a friend of mine, she was a nurse. I guess she still is a nurse. And if she met a new fella, and she didn't do this often, she's a very nice gal, but when she did, one of her first questions she would ask is, do you ever give blood? And I thought, that's an interesting question. Why is that? Because when you donate blood, they test you for a lot. Now, they don't test for herpes, but they test for HIV and other things. And if your blood is positive, they won't accept your blood. So it's a scanning process. It's not totally thorough, but it's a good way to kind of weed people out, depending on what you want. Again, it's totally up to you. Now, several factors. Back to birth control. I got to get off my soapbox here. Several factors and possible side effects to consider when taking long-term birth control pills. Birth control and cancer, according to National Cancer Institute, there's a mixed evidence that hormonal contraceptives may increase the risk of breast cancer and cervical cancer, but reduce the risk of endometrial, ovarian, and colorectal cancer. So there's a pro and a con. The hormones in birth control, including progesterone and estrogen, may stimulate the growth of some types of cancer cells and reduce the risk of others. Isn't that weird? American Cancer Society says that people who have taken birth control pills are slightly more likely to develop breast cancer than those who have never used them. However, the risk goes away when people have been off the pill for 10 or more years. So your body has the ability to heal. That's what's really neat about the body. And given the right opportunity, the body can heal from most conditions. Normally functioning nervous system, normally functioning digestive system, good nutrition. That doesn't say that you shouldn't seek medical help, you shouldn't take medication, you shouldn't have surgery. I'm not saying that. I'm saying I want you to have all the options so that you can make better decisions as to what to do. And that goes not only with birth control, but with everything. Neck pain, back pain, acid reflux, heartburn. I have patients come in almost every day in our offices and say, Dr. Joe, I was recommended for surgery. What's your thoughts? And we'll look at the MRI. My team of doctors will get together. We'll look at the MRI. We'll check the person out physically, maybe look at some x-rays, and then we can give an opinion. Hey, listen, I don't know if you need surgery or not, but let's do this. Let's try chiropractic care. Let's try nutrition. Let's try supplements, and let's do it for 6 or 8 weeks or 10 weeks, and let's see what happens. If it doesn't work, you can always have surgery. And a lot of doctors that I work with, all the doctors I work with, love that approach. I don't want to cut a patient open unless I have to, is what they say. So, Joe, if you and your team of doctors can work with them, great. And if it can't get to that point, then we can always do the surgery. It's a very safe, ineffective way to get, hopefully, great results. And if you don't get the results, we always have step 2. I say chiropractic first, drug second, and surgery last. That's my approach to healthcare in most cases. Now, American Cancer Society also reported that taking birth control pills for more than 5 years may increase the risk of cervical cancer. The longer people take the pill, the higher their risk. However, the risk should go back down gradually when someone stops taking the pill. Again, the body can start to heal itself. Large-scale studies published in 2018 looked at cancer prevalence in over 100,000 women ages 50 to 71 who were currently taking birth control pills. Now, again, these women probably postmenopausal, but they're taking it maybe for medical reasons. The study indicated that long-term use of birth control decreased the risk of both ovarian and endometrial cancers. Researchers are not sure why birth control pills lower the risk of certain cancers. It may be because the pill decreases the number of ovulations a person has during their lifetime, which exposes them to less naturally occurring hormones. Once again, I respect the study. I'm sure what they did was right, but why are the hormones out of balance to begin with? A lot of times people have adrenal problems. You have bags under your eyes. You're tired all the time. It could be adrenal fatigue. I recommend Dr. Joe's adrenal support. I recommend drinking lots of water. I recommend checking the nerve supply. The nerve supply in the lower mid-back or the upper low back goes into the adrenal glands. And we can adjust it, open up the nerve and blood supply to the adrenals. Get the supplements on there. Get off the foods that are stressing the adrenals. The coffees, the teas, the chocolates, the stimulants. If you smoke, gosh, folks, you've got to quit smoking. I'm begging you. Fix the chemical, fix the emotional, fix the physical stress, and then the adrenal glands have an opportunity to heal. And remember, the adrenal glands produce hormones for men and women. So one of the nice things you can do is take supplements to help feed the adrenal glands. Eat the foods that feed the adrenal glands. Because if the ovaries and the testicles are getting old, I understand that. That happens, but we can also get a backup plan with the adrenals. We have a backup plan for just about everything except your heart. We have 2 lungs, 2 kidneys. The brain has right and left hemispheres. You can damage one side. The other side can take over. So most things have a backup plan. Even digestion has a backup plan for proteins, carbohydrates, and fats. Got to give the backup plan for your reproductive organs. You got to treat the adrenals. 2013, a meta-analysis, which is an analysis of a bunch of different studies. 26 studies were used. They indicated the use of oral contraceptives containing both progesterone and estrogen increased people's risk of developing blood clots. Is it safe to use birth control pills indefinitely? Most people, according to the doctors, safely use hormone contraceptives for many years, providing their doctor recommended it. However, many long-term birth control methods contain hormones. This can cause problems depending on the person's medical history, their age, their overall health. Doctors may advise some people to avoid certain types of birth control. If a birth control pill causes side effects, people can speak to their doctors and change the pill that they're taking until they find the one that works for them. Once again, I'm not a big fan of medication, but I'm also a realist. I understand that people will be taking the pill. I want you to make better choices. People with a history of blood clots may prefer progesterone-only birth control pills or hormone-free IUD, which is what we talked about. The IUD, intrauterine device, is a small device. It looks like a T. And when a doctor inserts it up into the uterus, what it does is it prevents the eggs from planting in the uterus. And that's what happens. And so what happens is the sperm and the egg can still meet, but when it comes down into the uterus, it prevents the egg from taking root, so to speak. So currently IUDs last anywhere from 3 to 12 years, and people can get hormonal or non-hormonal versions of the IUD. Again, if it was up to me, I recommend the non-hormonal version. Of all the forms of birth control, assuming transmission of diseases is not an issue, the IUD seems to be the one that's going to have the least amount of adverse side effects with the women. Now, sometimes the IUD can fall out, so you got to be careful with that. But again, if you're playing in the big leagues, folks, you got to pay attention to this. You can't just say, well, I'm going to take the pill and I'm fine. Maybe not. Well, I'm going to use the IUD and I'm fine. Maybe not. That's why I always recommend learning the rhythm method in conjunction with other forms of birth control if your goal is to not make babies. Surgical sterilization options are also available for both sexes. However, most of these are permanent and they're completely hormone-free. Consider all your options and discuss possible health risks and benefits with your healthcare provider. Look up the side effects. Find out what's going on. Because if there are side effects, there's an issue. I read one study that men who have vasectomies can increase the risk of shorten their life expectancy. Now, that was one study. That was a while ago. But do the research before you go into getting whatever it is you're going to do. And it's okay. I have no problem with you, like I said, playing in the big leagues, but you've got to make those decisions. So consider this. Get the body healthy regardless of what the other options are when it comes to reproductive health. Normally functioning nervous system. The nerves control everything. So if you have pinched nerves going in your low back to your uterus or your testicles, it can affect function. The low back nerves control colon, sex organs, and bladder, along with back, hip, leg, knee, and foot pain. So if you have back pain, remember, it's not just the pain. Whatever organ is controlled by that nerve that's causing the pain is going to cause problems. If you have acid reflux, heartburn, burping, gas, bloating, you're not digesting your food properly. And in most cases, not all, but most, if we take the stomach and pull it down away from the diaphragm, we physically move the stomach away from the diaphragm, you're able to digest your food more efficiently. Your diaphragm's able to drop down, so you're able to breathe better. So there's so many benefits to physical health. And this, I believe, is the shortcoming in today's healthcare system. If we can get the body if we can get everyone to understand normally functioning nervous system, normally functioning digestive system, and good nutrition, you'll be amazed. We will save so much money. People will get healthier. We will save, when doctors are needed, because many times the doctors are so backed up right now, when they are needed, they'll have more time to spend with the patients. So if anybody out there listening, I'm available for Surgeon General. Let me come in and put together this protocol. And I'm not taking business away from anybody else. We're trying to get the people better so that the doctors can better serve the people that need them. I can't fix everything. My surgeon friends can't fix everything. 2 to 3 times a week, I'm out to dinner or lunch or meetings with orthopedic surgeons, neurosurgeons, hospitals, schools, universities, medical universities, chiropractic universities. People saying, Dr. Joe, we want you to teach us these techniques because we know they work. We just don't know what to do with them. So I've been speaking now for about 35 years. I have a list called the Dr. Joe Was Right list. And it's amazing. The Dr. Joe Was Right list, almost everything we've talked about so far years ago has come true. So I predict the future of healthcare is the normally functioning nervous system, normally functioning digestive system, and good nutrition because it makes sense. There's very little downside to doing that. And if that solves the problem, great. If it doesn't solve the problem, we then have medicine. We have surgery. We have psychologists. We have eye doctors. I wear glasses. I have to see an eye doctor for my glasses. So now the doctors are all starting to work together. This is the beginning of the change of healthcare. Europe is way ahead of us, by the way. Here in the United States, we're a little behind. But Europe is way ahead of us. When we catch up to them and then incorporate the things we teach you on these shows, I believe it's going to change health and your health for the better. So folks, if you're sick and tired of being sick and tired, if you have neck pain, back pain, shoulder pain, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time, you need to come see us. Stop suffering needlessly. Go to my website, drjoe.com, make an appointment right now for you, your friends, your family, and your children. If you're an athlete, if you have a child who's an athlete, when the bones are lined up properly, the body works better. I don't want you building up strong muscles around crooked bones. I want you building up strong muscles around straight bones. Our website, drjoe.com, all the supplements we talked about are there. Podcasts are there. If you want to make an appointment, it's all there. Folks, I'm Dr. Joe Esposito. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.